Kai. Beginning on October 1st, a big part of the Affordable Care Act, also known as Obamacare, will be in motion. Iowans will soon be able to start shopping for their own health care plans as part of the law's insurance exchanges. It's basically a marketplace for health care coverages. But there's a slight holdup. Iowa's insurance commissioner is now delaying when the state will release pricing information for health insurance policies. And for Iowans, time's getting tight as the rates may not be out until mid-September. KCRG TV9's Chris Earl explains why.
This uncertainty comes from whether or not the provider Coventry will be part of Iowa's exchange program. Coventry's parent company, Aetna, has backed out of 5 other states' exchanges, including New York, just last month. I spent the day looking at this very complex issue. How will it affect people who may be insured or looking for most effective, cost-effective insurance plan? And these health insurance exchanges, they're a critical part of the Affordable Care Act and the goal to cover all Americans and all Iowans. Yet there's a situation with the companies. Co-Opportunity Health up here, they're based out of West Des Moines. They're already in. They're committed for 2014. And we talked with the insurance commissioner on Thursday. He says they're just waiting for Coventry to officially commit for the exchange program for Iowa. This all comes as Wellmark, the state's largest and most dominant health insurance firm, will not participate in the health insurance exchange until 2015. Insurance Commissioner Nick Gerhardt talked with us on Thursday through a Skype interview from his Des Moines office. He said the new rates will be released after Coventry files all of the appropriate paperwork to join the exchange. The date could be as soon as September the 12th. It could be a few days later.
Our federal partners will have that agreement, and then they're going to let us know when those folks are ready. We really don't want to release anything until we know who's in the marketplace.
Absolutely it does. Well, Gerhardt sees this from the top of the organizational chart, if you will. Amber Downs is a non-traditional college student in Cedar Rapids. She's looking to possibly use the exchanges. She's waiting for the rates to come out as she tries to choose what will work best for her. Think it's fair?
I think it all depends on the person, what their income is. I think that there are some people, that maybe $50 would be too much for them to pay because they're worried about putting food on the table, they're worried about gas, they're worried about taking care of their children.
The insurance commissioner's office also insists the pushback on the health insurance rates will not have that dramatic of an effect for those who may be looking to a new policy. But here are the dates you'll have to know about for the coming weeks and months. October 1st is when the Iowa Exchange opens for a 6-month open enrollment period. Next big date to know, January the 1st of next year, 2014, is where the coverage is supposed to start. The open exchange, though, for 2014 will close in 2014. That ends on the last day of March, March the 31st, and that will wrap up the open enrollment period. Over the coming weeks, we anticipate more follow-ups, track the progress of the implementation, and to make sure the proper information gets out.
And that was TV9.